When I woke up after surgery, I felt like, okay, maybe I can go back to work soon, and that was not the case. I was exhausted for definitely a week and maybe 2 after that.
When I woke up, I was tightly bound with a lot of bandages, and the one thing that I really remember is having a hard time taking a deep breath. It felt like something was, pushing down on my chest, and I think the reality is it was a lot of the muscles were just really tight, and it was difficult to take a deep breath.
So when I finally did look down and see, my breast wrapped up, it was very shocking to see that there was pretty much nothing there. To see the scars that ran across from where my nipples used to be.
When I woke up from the lumpectomy, I was surprised about the pain I was in. The incision hurt, but when they took out the lymph nodes really hurt. And I was surprised about how my energy level was so low. It took a few weeks for it to come back.
The most surprising thing was that they had to put a drain in to drain out all the fluid they used to kind of clean out the area. And it had to be in for quite a few days. And then when they pulled it out, it was kind of pulling it out from a very tight spot. And that was very painful to me. I
Was petrified of the drains. The drains were, I thought they were going to be extremely painful for me. So I really built up this fear in my mind to the point where I was like having anxiety. After the surgery, when the drains were in there, they were very uncomfortable, but I wouldn't call them painful. And they were annoying. Overall, I would say the drains weren't as painful as I built them up to be in my mind.
To take a shower with drains, I think there's probably two ways you can do it. The first is kind of take the drains, and if you have a hook outside your shower, you can kind of hook everything out there. Or if there's somebody you're comfortable with, maybe they can put their back to the shower and just hold the drains for you, while you're taking a shower. Wearing a sports bra sounds like it's pretty straightforward until you realize how difficult it is to put it on and off in terms of raising your arms up. So one of the things I found helpful is they do have sports bras that have a zipper in the front, and I did buy a couple of those before my surgery.
My husband literally went to Old Navy and got me a running sports jacket, and just the inside of the pocket was a perfect little spot to put my drains in.
The physical therapist also recommended better bras, sports bras, stretch bras, things that could be put on with hooks and were more comfortable and would not interfere with any of my incisions under my arm or any other place. And it made such a difference. And I wore those bras for weeks.
The other thing that I learned very early on when I got home was to put anything that I needed that was on high shelves to a lower point so that I could reach them more easily, because right after surgery, it's really difficult to raise your arms very high.
A friend of mine is a therapist, and she came over to the house, and she worked on my adrenal glands to release the endorphins, to help me relax, to help me with my sleep.
Yeah, one of the things that someone else had told me that I found very helpful was getting a wedge pillow. It helped in terms of being comfortable laying in bed, and it also helped being propped up so that when I got out of bed in the morning or during the night, it wasn't kind of going from a laying down all the way up. You were sort of halfway up already.
In my case, I'm somebody who's very independent, so it was a little difficult for me to ask for help, but thankfully I didn't have to ask for help. Someone came to my aid, and it's a necessary evil for somebody like me. It's like, as I said, it's difficult to ask for assistance, but if somebody offers you assistance, please avail yourself of them, because it'll be the best thing you ever did for yourself.